morning everyone. Myself Dr. Prashant Joshi, consultant pediatric robotic surgeon and pediatric urologist at Sir H.N. Reliance Foundation Hospital and Research Center, Mumbai. First of all, would like to wish everybody happy National Pediatric Surgery Day. Every year, 29th of December is celebrated as National Pediatric Surgery Day because pediatric surgery as a branch got sub-specialized from general surgery on this day, and it was founded on 1965 by Indian Association of Pediatric Surgeons on this day. Topic of discussion today is emphasis on the laparoscopy and robotics, which has changed the lives of children undergoing surgery in the last half of the century, basically the last decade of the last century. And in the first quarter of this century, we have the robotics which is taking up. I would like to talk on that, the indications for laparoscopy and robotics, how we do it, when we do it, what is the timely diagnosis, why it is important, and how early we can get the patient discharged from the hospital, which is the basic anxiety of the parents who are undergoing surgery. So first of all, the age group. As I told that surgical patients require surgery as early as possible. You can see my last videos both in the urology part, the GI part, the thoracic part. Timely diagnosis and intervention is the first and foremost important thing. That I will always emphasize in my videos. So once a timely diagnosis is done after evaluation, it will be done either by us if you come to us directly, or it is already diagnosed that the child has got surgical problem either in the abdomen, in the thorax, in the kidney, or in the urology system by the pediatrician or by the family physician, and then the child gets referred to us. So the modalities of surgery which are offered to you when you will be going to a pediatric surgeon are open, which is the standard operative procedure followed since maybe thousands of years. The open surgery, then recently which has come is laparoscopic surgery, which started around 25 to 30 years back. It has gained momentum and most of the surgeries now are done laparoscopically only. And the recent is robotic surgery, which was first done by me in 2017 in this hospital. And since then it has gained momentum, and it is also robot assisted surgery is also sort of minimal access surgery which we offer to the patients. Now, what is the reason why they have come into existence? First is the technology. The technology is innovating day by day, and if it is beneficial for the human being, then it should be adopted. There is no doubt about it. So initially when laparoscopy came, there was little bit rejection from the community, and eventually it got accepted, and now you can see that most of the surgeries are done laparoscopically only, so which is also called as keyhole. So much so that if the patient is given the surgery of doing by open, they come whether laparoscopy is available in the hospital, and if laparoscopy is available, they undergo surgery, and they are aware about the advantages of the laparoscopy. Whosoever is not aware, it might be helpful, and whosoever is aware, I can enhance their knowledge by saying that laparoscopic instruments, we have pediatrics and neonatal both available. So these are very small instruments, the 5mm and 10mm. 10mm camera is used in adults, 5mm camera is used in pediatrics. And the working ports which are 5mm, which are generally used in adults, we have 3mm ports also in pediatrics. So the surgery, once it is done, it is hardly visible. You hardly see that the patient has undergone surgery. That also motivates the parents and the anxiety, because the child eventually has to spend the entire life post-surgery. It is not that we give a guarantee of 10 years, 15 years. Once the pediatric problem is solved, then he can have a normal life. In most of the surgeries, which are diagnosed early and intervened as early as possible. So laparoscopically, basically both in laparoscopy and robotic, we use a camera port. Camera port is in the umbilicus. Now we have 5mm, 10mm in laparoscopy, 8mm and 12mm in robotic. Now these ports go through the umbilicus. They are used as camera, and we visualize the abdomen, which is called the diagnostic laparoscopy. If we use it in the thorax, which is called as diagnostic thoracoscopy, and eventually, depending on the disease, whether it is appendicitis, gallbladder, or diseases of the intestine, of the kidney, we have to deal with it like we use the right hand and the left hand. We have to use the working ports. So 5mm and 3mm working ports we insert depending on the pathology, so that we gain the triangularization. We approach the organ that way. So one is the right hand and one is the left hand. So similarly, there are two ports. One is working port on the right side and one the working port on the left side. Laparoscopy, it is done on the patient only by us. Once we do it, and the pathology has to be removed. We generally remove it through the umbilicus, because umbilicus is anyways a scar. Or if it is a bigger specimen, we take a small incision, we remove from wherever it is like cosmetic. Robotic also, it is the same thing. The camera is put in the umbilicus, but the right and the left arm is taken care of by the robotic ports, and the robot we control from the console, which is little bit away from the patient. So the advantage of robotics is that whatever fulcrum is there, it is not there like in laparoscopy. So we have freedom of movement, which is almost like the wrist, even more than that. And we are able to operate in cavity areas like pelvis, thorax, and even where suturing is required, where it is time consuming and fatigue involves in the camera, in which the camera has to be held by the assistant. That part is also taken care of by the clutch which is there in the robot. The recent robot is, as initially we had SI system, which I had operated the first case, then now we have the XI. So many things get sorted out by the robot, and it decreases the fatigue on the point of surgeon while operating the patient. However, the advantages of laparoscopy and robotics are the same. There is scar is less. I mean, there is hardly any scar visible. Then pain is less. Precision wise, it is the best, because you operate on that particular organ only, and you don't dissect other organ, and you reach that area where you want to reach, because the magnification is there in the system. So you see it enlarged, and you operate only that operative area is operated which is required. So surrounding areas get protected very nicely. As compared to open laparotomy and all, you have to open the entire abdomen, and the scar will be more, and that's why after closure of the muscles and all, the pain also will be more. So that part also decreases. So that anyways people know. The advantage of robotics is that we can go in the very small and pelvic and small cavity areas, which is not possible by laparoscopy. Even if it is possible, you require advanced laparoscopic skills to suture it. Also, your assistant should be that much good to hold the camera till we finish the procedure. So operative time is almost same with the new robot. The docking becomes very fast. So initially we dock the robot, we put the camera, we put the robotic arms in the working ports, and then the robot is on to go. Now, systems which are involved, we generally do it in all the systems, more so in the urological system like pyeloplasty, robotic ureteric reimplantation, in the GI, bowel anastomosis. When removal of any organ is concerned, I think the laparoscopy is standard procedure like laparoscopic appendicectomy, cholecystectomy, splenectomy, nephrectomy. That also can be done by robot, which is done abroad. But however, the cost effectiveness wise, laparoscopic is better. And in thoracic, many reconstructive procedures which can be done in tracheostomy fistula repair, which can be done both by laparoscopy and robotics. So it was just an overview talk on how the techniques of laparoscopy and robotic has evolved and taken up by the pediatric surgeons. So in order to give a message to the community, whenever there is a surgical thing involved in a child, and it is you know that he will be requiring surgery, it's better to get operated in a timely manner. As small as infants to as big as adults and children undergo laparoscopy and robotic without any complications. Minimal complications of any surgery which are there, bleeding, infection and all, that will be explained to you. And recovery is faster, morbidity is less. Patient can go to the school as early as possible. And I hope that relieves the anxiety of many of the parents who are listening to this video. And I have also enhanced the knowledge of people who are already undergoing and underdoing laparoscopy and robotic. So on this National Pediatric Surgery Day, the emphasis on the minimal access aspects of the pediatric surgery, which we already have in our hospital, and we are doing it since inception. Thank you very much.